Unfortunately, those diagnosed with either bipolar 1 or bipolar 2 disorder have a 30 to 50% or higher chance of developing alcoholism and substance use disorders. In fact, individuals experiencing mania are 14 times more likely to have a substance use disorder involving drugs and 6 times more likely to struggle with alcohol use disorder. In the opposite direction, those with a substance use disorder are 3.7 to 13.4% more likely to experience mania or hypomania than the general population. Accordingly, bipolar disorder and addiction feed off one another in a brutal fashion. Hi, I'm Dr. Glowiak, and I'm a licensed clinical professional counselor specializing in addiction. Let's go over the similar connections between the development of bipolar disorder and substance use disorder. 1. Desire to self-medicate. Due to the overarching stigma on mental health and addictive disorders, many who would benefit from medication go without because they feel the treatment would make them less than others, which cannot be further from the truth. Unfortunately, this mindset often leads those experiencing either disorder to self-medicate through alcohol and other abusive substances. The issue here is that bipolar leads to an imbalance of neurotransmitters. The addition of foreign substances into the body, particularly those of abuse, only serves to disrupt homeostasis, the neurochemical balance, further. Though the initial effect may feel desirable to the individual, it will ultimately develop an accelerated pathway to addiction, from which many struggle to escape. 2. Abnormal brain structures. The prefrontal cortex, PFC, is best recognized for facilitating our morals and judgment. It's used for processing right from wrong while making safe and socially acceptable decisions. For individuals diagnosed with bipolar disorder, there's a noticeable difference in both the prefrontal and anterior cingulate cortices. Therefore, their problem solving and concentration are significantly compromised. Additionally, the natural process of neurotransmitter and hormonal release and reuptake is compromised. While either condition may prove problematic for self and others, the two, in combination, yield increasingly complex risks. A similar abnormality is seen in the PFC in those with addiction, impacting their self-control and internal reward systems. The brain abnormality seen in substance and bipolar disorders can lead to the decompensation of attention processes, impulse control, memory, cognitive flexibility, affect, mood, hygiene, and productivity. Whether in the presence of psychotropic medication or not, substance use of any kind does compromise stability. While it is recommended that substance use be avoided entirely, those who decide to use are strongly urged to proceed with caution. 3. Genetic predisposition. When considering any mental health disorder, it is crucial to assess the impact of nature versus nurture. Insofar as the nature piece, there's a genetic component in bipolar disorder and addiction that increases the likelihood of developing either if a parent had it previously. This predisposition is evident as there at least a 40% lifetime prevalence of developing a substance use disorder for those with bipolar 1 disorder. If one's biological parents are comorbidly diagnosed with both, the likelihood of this is even more significant, especially if the child has learned to model the behaviors of their birth parent. Does substance use make bipolar symptoms worse? Substance use absolutely makes bipolar symptoms worse. We must consider how either condition is invasive and, in combination, symptomology is heightened. One condition reinforces the other in a vicious cycle, effectively acting upon one another. Substance use can impact the severity of bipolar disorders, including intensified manic and depressive symptoms, increased aggression and agitation, longer and less manageable episodes, increased risk-taking behaviors, struggles to maintain a daily routine and schedule, higher rate of suicide, and diminished quality of life. Final thoughts: a co-occurring diagnosis of addiction and bipolar disorder may be discouraging, but there is hope. Adherence to a treatment regimen is one way people can begin living a more well-balanced life. Fortunately, treatment options are readily available and come in numerous forms. Remember that you are not alone. If you believe that you are struggling with addiction and bipolar disorder, help is out there. Your life is always one worth saving.